the middle class is becoming either rich or they're becoming poor. And the reality is that most are becoming poor.
This is Secrets for Success.
Welcome to the Secrets for Success podcast. I'm your host, Greg Todd. Thank you, as always, for joining me. Today's episode, I want to talk about what's really happening in healthcare, what's happening in the world right now. And this is actually something that I talked about on the summit that I did last weekend. And I think this is just really important that we stop and we ask ourselves, what am I doing and how am I dealing with this and addressing this? Not only with our current clients and patients, but for those of you that have a team, with your staff. And so this is something that I shared with people. I was like, look, we have middle class people, we have lower class people, and we have upper class people. Basically, we have rich, middle class, and poor. Which group is getting smaller? Is the rich people group getting smaller? Is the middle class getting smaller, or the poor? Guys, the group that's getting smaller is the middle class. Do you know that from 2023 to 2026, we have doubled the amount of millionaires that are in the United States? And do you know that from 2026, it is projected that by the end of 2028, the number of millionaires in the United States will double again? What? Is that crazy? It's happening. I think by 2030, it'll be nearly every year. The number is going to double. What? Okay. But not everybody's doing great. There's a lot of people that had white collar jobs that are not doing very well anymore. They have lost their jobs, and they've lost their jobs to AI. And that's just a reality. So the middle class is becoming either rich or they're becoming poor. And the reality is that most are becoming poor. And I think we have to acknowledge that. We have to acknowledge that from two standpoints. Number one is our patients fall into one of those categories. The majority of the things that we sell to our patients are middle class products, especially if you're doing it in a traditional way. We sell a plan of care. A plan of care is not a $10,000 offering. It's also not, $100 and then you're done with me, right? We're asking people to invest time, energy, and money into working with us over a period of time, whether that's, 3 weeks or 3 months or 6 months. But that's probably middle of the road products, right? It's usually, for the most part, not going to be $10,000, $15,000. It's probably going to be somewhere between $1,000 to $2,500, right? It's a middle of the road product. Well, what audience buys middle of the road product? Middle class people. That's what they buy. And so here's the problem. The problem is that is the group of people that is getting less and less and less. So that's number one. I think number two is that in America, 4 million people, 23 to 24 million people relied on subsidies through the Affordable Care Act, and those subsidies are now gone. And so these people that used to have premiums that they could afford can no longer afford it. And now they are either A, not having insurance, which is what most people are doing, or B, they are putting so much of their money that they didn't allocate before to these higher premiums that they don't even have the money and the resources to be able to stay in the services that you provide for as long, because it's not like you paid the premium and then you don't have copays and all the other stuff. So things are getting tight. So we're finding it much harder and harder and harder to be able to serve those middle class clients because they are now going to that lower level. Or they're like, shoot, I lost my job. I got to level up. I'm learning how to do something else that's in a different industry. Some of them are having success and now they're richer. So what I'm telling you all is this. I'm telling you that there are two groups and two opportunity bubbles that I see. I see an opportunity to serve people with healthcare needs at a much lower price point than what you're used to doing. I see an opportunity to serve people with higher level healthcare needs that want a total experience and they want a transformation and they're willing to pay premium dollar for it. Why? Because they have it. And the other people, why? Because they don't have it, but they still need the problem solved. So my question to you is, how are you doing that? Now, I'm just bringing this up because, well, I just want to show you this. This is actually, for those of you that are not watching me, but you're listening to this, I have in my hands a workbook. This is a workbook from one of my clients who's also my cousin. He just sent this to me. He said, hey, I want to send this to you because you were kind of the inspiration behind this. And all the things that you taught me. I created a membership and I created this workbook. And, he's making good money from it and whatnot. And guys, it's so simple of what he's done. I'll bring you guys through it in a second. But he's a personal trainer, okay? And he's been a personal trainer. He's been a personal trainer for, I think, 20. Yeah, he even says, Blaze Goldsmith has been a fitness professional for 20 years, right? This guy he's one of the best trainers out there. I mean, I've been to his classes. And I'm not just saying that because he's my cousin. He's so stinking good at this stuff, right? But even with him, as good as he is still doing a trading time for money job. So he was like, all right, I got to productize myself, right? And then, I remember even asking him this a couple years back. I'm like, well, what makes you good? He's like, well, I'm just good. I think I've been doing it a long. I was like, no, let me tell you what makes you good. When you're doing your classes, some people are like, hey, I'm going to tell you, do this, do lunges, do this, do that. He's like motivating and he's inspirational and he pushes you, right? And he's obviously got good moves and all the other stuff. But really, that's one of the big things. And with that said, you'll still be broke. If you're just trading time for money with an audience that's used to doing middle of the road stuff. He doesn't have as many middle of the road clients because middle of the road, middle class America is going away. So here's what he did. He created this Blaze Your Purpose in Less Than 30-Day workbook. Okay, now is he teaching you exercise in here? No. Here's what he's doing in it. He says, I'm now a transformation coach, right? He's helping people develop transformations. He knows that with fitness, it's not just about the exercise, it's about the mindset. Okay. So what he did is he created this workbook, and this workbook is over 30 days. All right. And basically what he does is every 30 days, someone would have to get this workbook. And the first part of the workbook is how to blaze your purpose. His name is Blaze, right? Okay. His name is John, but it's how to blaze your purpose. So the first part of it, okay, what is your purpose? What are the things you need to stop doing over the next 30 days? What are the things you need to do less of? What's the things you need to keep doing? What are the things you need to do more of? And what are the things you need to start doing? Okay. And then he explains his daily success habits that he believes that if you do these habits, it's going to amplify your life. Breathing, speaking, listening, moving, right? And then he has his affirmations. These are things that he's telling his clients that they should be saying on a daily basis. And then he talks about the daily success habits, right? And then he kind of has his lion, cub, his lion prime, his lioness, right? That's like your lion cub is your joy. Your lion pride is your talent. Your lioness is your service. Your lion quest is your calling. Your lion pride is your power, right? And he gets them to fill out certain things. And then for the next 30 days, he makes them track the things that he wants them to do on a daily basis so that they get the transformation that he's promising them. What are their top priorities for the day? What things can they release? What are their daily success habits that they have done? He has his here that he talks about, the breathing, the speaking, the listening, the moving, and then any additional one, he has a section for that. What is the challenge for today? What is the big win you could share today? What is the thing that you're grateful for today? And he does that day 1, day 2, day 3, day 4, day 5, day 6, day 7. And he does that every single week, week 1, week 2, week 3, week 4, right? And then at the end, it says, let's reflect on your accomplishments. Guys, I don't think this took him very long, but you know what he just created? He created an entry-level product. It's a physical product. He already has clients. He has clients that can't afford him anymore. So this is a way for them to be able to get some value from him. It's something that if you love it, you're going to want to not only get this one time, you're going to want to get this every 30 days. So he created a recurring revenue physical product that can go along with his recurring revenue membership, his community. And now it allows him to take the middle class clients that he was working with before and now to give them an entry product, something that they can afford and still get value from. Or fine, you don't create it, don't get anything at all from them. Is that making sense? We'll talk about this on another podcast, but the premium is understanding that there are people that are doing very well. You might not be doing great, but there are people that are. So you just have to decide which group are you going to serve. If you're going to serve the premium, then fine. You could still use something like this, but add it in with your plan of care. Create a solutions-based offer to where it's like, hey, I'm not just going to treat you. I'm going to give you accompanying tools so that you can get a higher level transformation from me. Does that make sense? So use it as a standalone, cheap. Use it and combine it with what you are doing with them already in person, premium. And that's what we have to do. We can't just stay in the middle of the road anymore because that group is drying up. So I hope this helps you. I hope this serves you. That is what's going on. One of the things. There's like 5 or so more, and I'll talk about it. I'll kind of interject them in between podcasts. But I think that will help you, that will serve you. And I want you guys to start thinking, what the heck do I need to do? By the way, what direction do I want to go? I wouldn't recommend for you to go premium and cheap. I'd recommend for you to say, okay, I'm going to go in one lane and see if I could start helping these people because these are the growing markets and we got to go where the growing markets are at. So anyways, I hope that helps you. I hope that serves you. I'll see you guys on the next episode. Until next time.